There's now no longer any question at all that the antidepressants cause suicide. They increase the rate of suicide. It began with the children's studies in Great Britain, where they found by reviewing the studies and the ways drug companies hadn't been willing to review them, that in fact the antidepressants cause increased rates of suicide in children. So then the US, they had to go ahead and do a lot of studies too, and same conclusion, antidepressants increase the rate of suicide in children. And then they actually went and reviewed, the FDA went and reviewed all the studies on whether it helps children to give them antidepressants. They found it doesn't help children. 3 out of 15 studies were positive, and 2 of them were a guy named Graham Emsley, who takes a lot of money from drug companies. So the drugs don't work in children, and they increase the suicide rate. They also increase mania, irritability, anger. They just mess up kids' brains, and they do all the things kids do when they get messed up. Well, then people said, well, what about adults? Dr. Breggin, he's been saying adults increase suicide rate. I've been saying that since 1991. And I actually went inside Eli Lilly and found their own studies showed an increased rate of suicidality, but they were denying it. I did that in product liability suits. Then I went inside GlaxoSmithKline and Paxil suits and found that they were hiding their suicide attempts. Eli Lilly had been hiding its suicide attempts. And I found all this out, told the FDA they didn't want to hear from me about it. Well, finally, there have just been so many reports, it's been going on for 15 or more years, that the FDA decided to start reviewing the adult studies and telling the drug companies to go about this a little more systematically, looking at their old data. This isn't even their new data, their original studies that were used to approve the drug. What do they find? In May of this year, 2006, Paxil sent a letter to all health professionals in the country telling them Paxil increases the suicide rate in depressed people. It's an excellent study that can be found on the American Psychological Association's website, where Kirsch and others actually reviewed all of the modern antidepressant studies from the FDA, not just the 1 or 2 used for approval. And they didn't find any difference hardly at all between placebo and the drug. So why do people take antidepressants? Well, they like the temporary high, or they get hooked into the apathy. But something more important happens. And this is the first time I've had a chance to talk about this on film. Drugs spellbind us. First, they disguise from us their adverse effects. Second, when we notice changes in ourselves, we tend not to attribute them to the drugs. Third, they often make us feel better than ever for a while in our own minds, when in fact we're worse than ever. We maybe even be in a manic state. And finally, and I have dozens of cases of this in my legal work where I testify in court on behalf of injured patients. I've got probably 100 cases like this where people actually do something horrible on the drugs. They murder, they commit suicide. I've got cases where they drown their children and then themselves, where they ruin their lives embezzling, most often on the new antidepressants like Prozac, Paxil, Luvox, Celexa, and so on. They're totally spellbound. They think they're on some kind of mission to kill, or they've determined they must kill themselves, or they think they can embezzle in the most obvious and stupid ways. They're spellbound by the drugs. And that's why we have alcohol and marijuana, why we have people ruining their lives to get heroin. And it's the same reason why people stay on psychiatric drugs. They don't know how bad the drugs are actually being for them. We could do entirely without antidepressants in this world. Entirely. People don't need fakery and chemical anesthesia and chemical highs to deal with life. It's the wrong way to deal with life. People need to be reminded that life is about taking charge, taking responsibility, developing some wisdom, getting some understanding, finding good values, learning to love. There's no way around that problem.